The National Surgical Commissioning Centre is a web-based resource available on the Royal College of Surgeons website. It offers information, guidance and advice for commissioning surgical services. The programme is supported by RightCare and NHS England and is accredited by NICE. The centre was developed in cooperation with surgical specialty associations and brought together surgeons, commissioners, patients, GPs and various other clinicians and healthcare professionals to develop the commissioning guides. These guides are designed to support commissioning of high-quality services, to provide evidence-based, cost-effective care by showing commissioners practical examples of high-value care pathways across a range of conditions. Alongside the guides, there are data tools. These highlight the variation and provision of surgical services. Commissioning guidance is not intended to replace existing clinical guidelines, but to set them in a context with information to support commissioning.
Well, as a CCG Commissioner, this is a great set of tools that you can use to look and see what services you should be providing for your patients. It tells you both about how much you're buying at the moment, so there are tools online that show you how much you're providing for your local community compared to your other CCGs around you and across the country, but also tools that tell you about the quality of the services you're providing, which is a good place to start a conversation with your provider around the quality you're providing, how much you want to purchase in the coming year. And so, as a commissioner, it's very hard to know whether you're buying more or less than you need, and you go into this annual commissioning round, you have historical data, but you don't know whether that relates to the best practice or just bad practice. It's just historical data. Now this gives you a real example to share your data, look and see how you compare with others as a good indication of what you should be buying for your local population.
Well, the involvement of patients has been central to the work of the National Surgical Commissioning Centre, and each of the commissioning groups had 2 patients' representatives whose responsibility was to ensure that the needs of patients were at the centre of the work of the group. Patients have been concerned in the past about possible regional variations in the access to surgical care, and the guidance promoted by the National Surgical Commissioning Centre goes a long way to addressing those concerns.